Hello, everybody. Welcome back to the Hello, everybody. Welcome back to the three-day National Pharmacy Week celebrations that are being organized by Chebrol Hanmaya Institute of Pharmaceutical Sciences in association with AP State Branch, IPA, and the Education Division of Indian Pharmaceutical Association. As we all know, the third week of November is celebrated for all the services that are being offered by the pharmacists all over the country. So, in this occasion, there is a small clipping by the principal of our institute, Dr. S. Vidyadhara. So, after that, we will proceed on to the session.
Greetings to all pharma fraternity. It gives me immense pleasure to be a part of pharmacy profession and Indian Pharmaceutical Association as the Vice President of Indian Pharmaceutical Association and Chairman of Indian Pharmaceutical Association Education Division. As we all know that we being the pharmacists celebrate the National Pharmacy Week during the third week of November throughout the country in a very systematic approach with a specific theme for promoting and propagating the healthcare through pharmacists. The theme for this year's National Pharmacy Week celebrations is chosen as Pharmacists, Frontline Health Professionals. I can wholeheartedly say that this is the most appropriate theme for the current scenario, which highlights the importance of pharmacist and his role in the profession of healthcare. In the current COVID-19 pandemic, there is a significant shortage of healthcare facilities that are being offered not only to patients affected with COVID-19, but also to patients with pre-existing ailments without being affected with COVID-19. This is exactly where we pharmacists can serve our duty as frontline healthcare professionals by offering drug manufacturing, clinical, and community pharmacy services both at hospital as well as at our surrounding community. Responding to minor ailments, patients counseling, and medication monitoring are of significant importance to patients with long-standing ailments who cannot access the healthcare centers due to the overload of COVID-19 patients. Pharmacists can play a vital role in offering professional services at hospitals where there is a notable shortage in medical practitioners and nursing personnel. Therefore, with the above said introduction briefing, there is a great scope to portray our role as frontline healthcare professionals, and the most suitable platform to do so is none other than the National Pharmacy Week celebrations, which are going to be organized from 16th to 23rd of November 2020. On this August occasion, I wholeheartedly wish all the IPA members and its affiliating bodies and also the fellow pharmacists to take this opportunity and make it a grand success. Thank you.
Thank you, Dr. S. Vidyadhara, for your introductory note. So, all the participants who have been with us for the last 2 days, you are all aware that this institute is organizing this 3-day workshop or 3-day celebrations to make sure that the pharmacists are being made aware of various developments that are being that took place during this period, especially with COVID as the limelight. So on day one, we came to an understanding through the words of a clinical pharmacist. On day two, we came to the understanding through the lights of a physician. Today, we have with us a famous physiotherapist with us who can put her details or put her inputs regarding the same. So we have with us today Dr. Sudeepthi Vardhan, consultant physiotherapist at Vasavya Physiotherapy and Rehabilitation Center, Vijayawada. She is a practicing physiotherapist in the field of cardiovascular and pulmonary physiotherapy, antenatal and postnatal physiotherapy, and also in orthopedic physiotherapy since the last 10 years. And recently, she shifted her focus in clinical fitness and physiotherapy to women with PCOD, with infertility, and obesity, as she claims her passion to make women fit from the fit in health right from their childhood to their geriatric age. She's also an active member in medical social work along with Dr. D. Samaram, who is the ex-national president of Indian Medical Association. Apart from this, she's also a teaching professor in physiotherapy to undergrad students at university level. Ma'am, I would like to transfer the platform to you as you deliver your lecture to all of us. Thank you.
Thank you so much, Raghava. Good afternoon, everyone. I'm Dr. Sudeepthi Vardhan, and as Raghava told, I've been practicing physiotherapy since 10 years here in Vijayawada itself. And also, I'm very much passionate about teaching because teaching is a profession where we can spread knowledge and enlighten the young minds. And so I've been teaching since 12 years. And recently, I've around 2 years back, 1.5 years back, I've joined the NRI Physiotherapy College. And yes, so I've heard the topic is really very interesting since the COVID scenario. Whatever lectures or whatever seminars or webinars whichever being conducted, I think around the whole world is nothing but about COVID. Yes, so any article we see, any webinar we hear, it's about COVID. So it gains a very important, it is such a thing which need to be discussed, which needs to be we need to keep on discussing about it because, it's not just like the disease is mutating and all the symptoms we see, the age groups which are getting affected and the outcomes are also keep on varying. So it's a continuous subject. And so as a physiotherapist, I would like to talk about the role of physiotherapy in COVID-19. See, since as we all know, COVID-19 is mostly affecting our lungs. It's a respiratory disease. Okay, so we play a major role, not just physiotherapists, every healthcare professionalist, everybody are playing their role. So as a physiotherapist, I would like to put light on our role in mostly treating this. So we are directly in contact, just like other physicians and clinicians. We physiotherapists are also in direct contact with the patient. So we are not like, it's physiotherapy is not something which cannot be done telepathically. Okay, we should be there with the patient, hands-on treatment for the patient. So we are susceptible, just like other clinicians and physicians and nurses and everybody and every frontline healthcare providers. We physiotherapists are also very susceptible in transmitting the disease and in getting the disease. So so we should be also very careful. So as we all know, I would like to share my screen now, and I would like to start about just a few things about the COVID general thing. Like, just give me a second. First, about what symptoms we can see, what is the incubation period of COVID, and what to do if we, if we ourselves end up, having some few symptoms and how susceptible we are. And then I'll go for the physiotherapy part. And today I'll be mostly focusing on the respiratory part, the breathing exercises part. So I hope my screen is visible.
Yes, ma'am, it is visible.
Yeah. So I wanted to name my topic as breathing for better life. Okay, because, especially pertaining to this COVID situations, the most affected things are our lungs. So when our lungs are affected, obviously we are compromising with our breathing. So when we are compromising with our breathing, you are taking less of oxygen, okay, and it is affecting our body muchly in ways we can't imagine. So I wanted to name this as breathing first, better life, because I'm emphasizing on breathing exercises, simple breathing exercises that can be done. Okay, so I've already told you about this. Now we'll see about the incubation. We know how this disease is spreading, how this COVID is, this pandemic is spreading. We know it spreads through person to person. Okay, so I would like to talk about the incubation period. Incubation period is like uh, how many days will it be in us, and how many days will it take, to show the symptoms, and how many days it stays like in a person. Okay, so what is the incubation of this coronavirus? So it is always not possible to know, okay, when people were first infected, because there are people who are asymptomatic, and there are people like who get symptoms like within a day or within 2 to 3 days, and few people get the symptoms maybe after a week. They have acquired this coronavirus. So it is not always possible to know when people are affected, when people are first infected, okay, and especially if they may have received the several doses of virus. So once it could be a very non-virulent strain, and you might have exposed yourself to a very mild thing, but then you keep on exposing yourself and the virus builds up, okay, and then you might start showing up symptoms. Okay, next, also there is significant variation in the length of time it takes people to develop symptoms, as like just as I said, that people could be asymptomatic, like no symptoms at all, so we can't even judge like when they have, which day they are in, which week they are in. Okay, so there is significant variation in the length of time it takes for people to develop symptoms, and also it depends on the person affected, their immunity levels, their age, their pre-existing health conditions and all. Next, and also few countries, okay, they only test and confirm coronavirus with people with suffering with severe infections, and also it is not known if the incubation period of these people, like with critically ill people, severely ill people, moderately ill people, mildly ill people, the infection could be different. Okay, so the infection could be different. That is why the incubation period also might be different. And also, it is always thought that many people do not develop symptoms, as I said, asymptomatic cases. And I would like to stress on these asymptomatic cases because I'm not aware. I might be having this coronavirus in me, and I'm not aware because I'm asymptomatic, and I go and I spread it, which is very, 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 very wrong, and also difficult, because we unknowingly we are spreading the disease for the people who might not be, as healthy as us, as me, and they could be suffering from pre-existing illnesses, and they might be showing symptoms, and they could get critically ill as well. The disease being transmitted from an asymptomatic patient could cause even death to other patients. So we should be very, very careful. So incubation period is clearly not known. Okay, next. So which symptoms develop first? So if we are suspecting that we might have symptoms, or somebody we know might have symptoms, so which symptoms develop first? Okay, see, and also I would like to mention that all these symptoms might not be seen in one person. Okay, these symptoms also might vary from person to person. I might be having just fever and body pains. Someone might have dry cough, tiredness without any fever, without any body pains, and some might just be showing up headaches. Okay, so it is not these symptoms, it's not necessary that if every single person is presenting with all these symptoms also differ from person to person. And also, if even if you are contacted with the same strain of virus, like if my husband or my family members, we all are tested positive. So we might be catching the same strain of virus. Yet I might be showing up few symptoms. My husband might be showing up few symptoms, and other family members might be showing up few symptoms. So, but generally, these are the symptoms. If you are experiencing any of these symptoms, it's better to go and get tested. Okay, so the symptoms include fever, as we all know, temperatures, high temperatures, fevers, dry cough, and throat irritation and severe tiredness. If you might not have any fever, cough, cold, nothing, but still you're feeling very, very tired. Okay, even though you're doing the regular work you're doing, you're not stressing yourself more, but still you're feeling very, very tired. You might be experiencing severe body pains. So you are a suspected COVID person. Okay, so tiredness, sputum production. Okay, when you're coughing, dry cough is a symptom, as well as productive cough is also a symptom. Okay, sputum production and shortness of breath or breathlessness. Okay, so shortness of breath or breathlessness means, you see, normally we are breathing relaxedly. We don't even have to notice that, or we don't even have to put our concentration on our breathing. But when there is shortness of breath, we tend to breathe fast, and it looks like work to us. Okay, so we tend to breathe fast. Usually the length of the breath or the depth of the breath is decreased. So you'll take number of the breaths per minute is increasing, and the depth of the breath is decreasing. Okay, so we might be experiencing shortness of breath or breathlessness, body pains, sore throat. Okay, where your the first symptom usually when we heard about coronavirus is sore throat. We were told like that the virus stays in the throat for 3 to 4 days, and then it goes to the lungs. So you might be experiencing sore throat, headaches, blocked nose, just like we experience in common flu, blocked nose. And one important thing, like we might experience all the above said symptoms in regular flu as well, but loss of sensations like taste and smell is very peculiar when we come to COVID-19 or this coronavirus. So there is significant. So you might be very healthy, happy, no tiredness, no fever, no shortness of breath, nothing, but still suddenly you can't smell, you can't taste. So you are a clear case of COVID, this thing. Okay, so loss of sensations like taste and smell. Next, redness of the conjunctiva of the eye. You might be seeing pink or redness in the eyes, and then diarrhea. A patient might be experiencing just motions or diarrhea. So these are the commonly seen or commonly developed symptoms first when we get in contact with the virus. Okay, next. So what to do if we develop symptoms? So we have seen what could be the possible symptoms. Okay, now what to do when we develop these symptoms? We should always check for the red flags. Red flags are nothing but these symptoms, right? So if you're experiencing fever, check for the other symptoms. If you're experiencing body pains, check for the other symptoms. So you should always check for the red flags. Okay, and next, when we are suspecting ourselves to be a COVID patient, first thing we should do is, of course, we should get tested. And even before the test result arrives, okay, just for the precautionary sake, we should self-isolate ourselves for at least 14 days, for a minimum period of 2 weeks, or for at least 14 days. Okay, self-isolation for at least 14 days. Okay, you should be separated in a room if you have to stay with other members in the family. So everything should be you should be self-isolated, not even with mask. You should come out. If you have to come out, everybody in the family should be wearing the mask along with you. Okay, next. Also, because the incubation period might be like 4 to 5 days, it differs, right? So if I am tested with, if I am tested positive, and today I got tested, and I've been staying with my family before today till yesterday, so we should also get them tested. And also,
Ma'am, I'm sorry to interrupt you.
Yes. Yeah.
Did you share anything PowerPoint presentation like that?
Yes.
Unfortunately, we are not able to see that since starting.
Oh my goodness. I'm sorry, I have shared.
Oh, nah.
I'll share again. I'm sorry, but I've been sharing the screen since I've started talking. I'll share again. Sorry. Is it visible now?
Ma'am, yes.
Okay.
Please continue.
Yeah. I'm sorry. Yeah. So we should ensure everybody living with us also get tested, and also they also need to be isolated from the society for that particular period of either 7 days, 1 week, or 14 days, or until they get tested negative again. Okay, and next thing is we should take plenty of rest and plenty of fluids, because we tend to get dehydrated. So we should take plenty of fluids and plenty of rest. Okay, and next is, when you are in home isolation, you should check if the symptoms are worsening. If like today you might be very fine, like just fever, 2 days with fever, and the third day, fourth day you might be good, but suddenly in the second week you might develop symptoms, and which might also worsen. Okay, so we should check if the symptoms are worsening, and if the symptoms are worsening, we should immediately seek for medical help, and if necessary, get admitted in a hospital. Okay, so these are the basic things we should do if we develop symptoms. Next. So, how to classify? We have been hearing about the classification, like, people randomly talk like, yeah, so and so got tested positive, but they are asymptomatic, and so got tested, they are saying that they are mildly symptomatic, and we heard that somebody is very critically ill. So what's the classification? How to classify this? So the terms which are generally used to classify the illness are asymptomatic, mild, mildly symptomatic, moderately symptomatic, severely ill, and critically ill. Okay, severely symptomatic. No, we don't say severe symptomatic. We say severely ill and critically ill. Okay, so generally used terms are this. So what are asymptomatic patients? Who are asymptomatic patients? So you might be tested positive. Okay, because unless you're tested positive, you don't know that you are a COVID patient, because you don't have any symptoms, and we don't realize that. So the test result comes positive, but you are free of all the symptoms. You don't have any symptoms. Okay, all the above mentioned symptoms, you might not be experiencing any symptoms. No fever, no shortness of breath, no body pains, no headache, no nothing, but still only your result is tested positive. And to confirm that, you should be undergoing an antibody test. Okay, so antibodies are formed, when our body is infected, it produces antibodies against the virus to protect our body. So when we get antibodies tested, if antibodies are formed, then certainly you have been suffering with corona, but still you are asymptomatic. Those patients or those people come under this asymptomatic classification. Okay, only the test comes positive, no symptoms at all, and antibodies are formed. Okay, next, mild symptomatic. Mild symptomatic cases are presented with fever. Okay, but the fever is not very high. The temperature is not very high. Okay, so fever, next tiredness, fever, tiredness, body pains, headaches, all can be experienced, but the breathing is not worsening. Okay, the breathing is good. I'm talking with you. Okay, I am a COVID patient. I have fever, I have illness, I have symptoms, but still I'm talking good. I mean, I'm breathing well. So the breathing is not affected in mildly symptomatic cases. You might have few of the above mentioned symptoms, but the breathing criteria is very important here. Okay, so your breathing, well, I mean, your breathing is not compromised at all. Breathing is not affected. Okay, these cases are called as mildly symptomatic cases, and asymptomatic cases or mildly symptomatic cases or moderately symptomatic cases, they all can worsen. Okay, not that you're mildly symptomatic and you're out of it. Maybe in the next week, you might, or one might get worsened. Okay, so when I've mentioned about mildly symptomatic, not that they are mildly affected or they are not in danger. Okay, they are equally in danger because the symptoms can get worsened. Okay, next coming to moderately symptomatic cases. So moderately symptomatic cases, they are present with severe cough and high temperatures. Okay, mildly symptomatic cases might also be experiencing fever, but the temperature is not very high. Okay, but when you're coming to moderately symptomatic patients, they have severe cough and high temperatures. Okay, high temperatures, and also they might be experiencing breathlessness or shortness of breath while doing activity. Like, I'm sitting, I'm taking rest, I'm breathing good, but I walk for a few, I take a few steps, or I do a work which I regularly do, or even a mild activity can trigger breathlessness in me. So they come under moderately symptomatic cases. So they could be experiencing severe cough, high temperatures, breathlessness on walking and doing daily chores. Okay, and also they might be presenting with diarrhea, which means motions, and nausea and vomiting. Nausea and vomiting also might be present to these cases. Next, severely ill and critically ill cases. Severely ill cases, they have breathlessness even while at rest. So they might be and they also cannot be able to finish a sentence without having to take breaks. Okay, so they are the breathing. So as we are seeing, when the disease is worsening, the breathing pattern is worsening. Okay, so when you're classifying mild, moderate, severe, critical, we are emphasizing, our focus is on the breathing. So on the lungs. So moderate, breathing difficulty on doing work. Severely ill, breathing difficulty even while at rest. So the patient must experiencing breathlessness even while at rest or lying down. Even lying down could be difficult. Sitting could be difficult, and they can't talk continuously because they are not able to catch the breath. Okay, they should end. Next is critically ill cases are they might be experiencing acute respiratory distress syndrome, and also they would be on ventilation, or they need artificial ventilation support. So we along with temperatures, along with heart rate, I hope every household is now having a pulse oximeter. Okay, pulse oximeter is a thing which is being bought very frequently now. So pulse oximeter, where it shows the pulse rate and also the oxygen saturation levels. So the healthy oxygen saturation levels are above 95. So 95, 96, 90, it never shows 100. It never shows 100. So it could be around 98, 99, 96, 97, 95. Above 95, we are good. And 90 to 95, we can improve it. And if the saturations are even below 95, we should take it as a red flag. It could be alarming. And below 95, definitely admitted in a hospital. Okay, so that's the classification. Next, so you might have heard about this, like what is COVID and symptoms and classification and all earlier. But so coming to my topic, what is the role of physiotherapy in COVID-19 management? So the physiotherapist's role comes here, even before, even for an asymptomatic case. If you are asymptomatic, you don't need any other management, but physiotherapy is a must, because you never know when the symptoms are getting worse, right? So it's better to keep our lung function at the best. So as a physiotherapist, we train your lungs. Okay, we help improve the breathing pattern, the lung function, the cardiovascular fitness, and mostly overall well-being. Okay, so now coming to COVID management. So first thing is assistance in clearing airway secretions. So there is sputum production, right? Productive cough, there is sputum production. When there is excessive sputum, it becomes again difficult. So assistance in clearing the airway secretions. Next, increasing lung volume, improving breathing pattern. Okay, improving breathing pattern and instruction for breathing relaxation techniques. Okay, along with working on the breathing patterns, along with working on the oxygen intake or lung volumes, we are also emphasizing on relaxation techniques. Okay, breathing relaxation techniques. Okay, next, we instruct for independent exercises like active cycle of breathing techniques. Next, lung drainage positions for clearing these sputums. Okay, so these are the part of respiratory rehabilitation. Next, instructions for positioning. Okay, like which posture, in which position to lie down for better breathing. Okay, you might be experienced, we have 2 lungs and 5 different lobes, right? So you can experience difficulty in the right leg lower lobe, or left leg apical lobe, right? So based on which is affected, we suggest the positions, in which position it is better for the lung to expand more, and for to breathe well without compromising when particular lobe is affected. Okay, so instruction of positioning like side lying, prone lying, and instruction for mobility also is given. Next, the respiratory physiotherapy treatment mainly will include instruction for function and mobility. Okay, we are talking about the functional improvement and also the mobility in order to prevent general deconditioning. Okay, generally decondition. A body, when it suffers from illnesses, there is psychological deterioration and also physical and physiological deterioration, right? So that affects the quality of life. Okay, the general deconditioning or deterioration, even physically and mentally, it affects this thing. So we should prevent general deconditioning and falls, and if necessary, the recommendation for a mobility aid. So mobility aid, like if the patient is very weak, very weak, and he's not about to stand independently, walk independently, our aim is to make him independent. Okay, so in that process, if required, we might also suggest a mobility aid, like take a walk, but the patient should be independent, making them independent first, and then, if necessary, providing all these, including mobility aids. Okay, next. Also, for any treatment, for any line of treatment, precautions are a must, and precautions are a necessity, right? So, precautions are very well taken and should and must be taken. Okay, next. First, initially, the patient should be, advised or talked about of what treatment we are giving to the patient. Okay, so we go, we sit and we explain, counsel the patient. Okay, the patients receive instruction for practicing breathing exercises. Okay, we should instruct them properly. Just don't sit in front of them and start doing. We should instruct them. So proper instruction should be given to practice breathing exercises and function in the ward while avoiding fatigue and dyspnea. Okay, so when we practice, even healthy individuals, when they do deep breathing exercises for a while, we experience fatigue. We tend to take a whew, we feel like, okay, I'm tired. Even just while sitting and taking deep breaths for a while, we feel fatigue. We experience fatigue. And in these cases, it is certainly, the cases, they certainly experience fatigue. So our focus should be on, teaching these breathing exercises without fatigue. Okay, without fatigue and dyspnea. Okay, next, during the treatment, the physiotherapist should pay close attention to the patient's saturations. As I earlier mentioned, like the pulse oximeters should be a must. Okay, they should be always, the patient should be monitored, because we should check for the saturations. Because even while doing breathing exercises, we tend to take more oxygen in, or we forcefully expel out more carbon dioxide. Okay, so, and also in the hurry of taking more oxygen or taking more breaths, we tend to decrease the depth of the breath. So when we are decreasing the depth of inspiration, the amount of oxygen taken is reduced. Okay, so we might always keep a check on the saturations while during the whole process of the treatment, especially for COVID cases. I'm not talking about regular cases. This is our emphasis is on COVID patients. So we should always keep a check on saturations and check for the signs of dyspnea, cough, and sputum. And generally, a functional assessment is carried out, and patient is educated about what we are going to do. Okay, next. So after the precautions, next, respiratory rehab. Coming to respiratory rehab, respiratory rehab includes breathing exercises and mobility, thoracic mobility exercises. Okay, breathing exercises along with thoracic mobility exercises. Why I'm saying this is because, as we all know, the lungs are in a cage, our rib cage, right? And this rib cage is filled with muscles, covered with muscles in and out, right? So the lungs need room to expand. Okay, we might not have any other, ailment with the lungs. Okay, our lungs are perfectly fine, healthy, but there's a problem with the rib cage, with the respiratory muscles. Okay, so the rib cage doesn't expand, and the lungs also fail to expand. They don't get the room to get expanded. So along with breathing exercises, thoracic mobility exercises are a must. Okay, where we are expanding our chest along with breathing. Okay, where we are, front, back, side, we are working on the expansion of the rib cage. Okay, working on the respiratory muscles, inspiratory muscles, and expiratory muscles as well. So respiratory rehabilitation includes breathing exercises and thoracic mobility exercises. Okay, So what do these do? Deep breathing exercises. Deep breathing exercises, they can help restore diaphragm function and increase lung capacity. Okay, they increase the diaphragm function. You know, diaphragm is the major muscle for respiration, right? So diaphragm function and increase lung capacity. Also, deep breathing exercises can lessen the feelings of anxiety and stress, which are common during these situations, right? When you are tested positive, even if you are asymptomatic, you don't have any other complaints, yet you are stressed because you never know, right? You just the test result itself gives, a lot of stress and lot of agony. Okay, so agony and anxiety. So deep breathing exercises, they not only help with the physiological improvement, they help with psychological improvement also by lessening the anxiety. Okay, by easing the anxiety and stress. Okay, next, because you are relieving your anxiety and stress during these breathing exercises, we also tend to get a good sleep, obviously. And certainly when we are not when we are in stress or in anxiety, you can't sleep, right? So when you are decreasing these levels, stress and anxiety levels, obviously the sleep quality is improved. Okay, and which is good for the overall health. So respiratory rehabilitation mainly focuses on that. Next, so I'd like to take through few exercises, which we can do at home, even if we are tested positive or negative. It doesn't matter if you're symptomatic, asymptomatic, mildly symptomatic. Doesn't matter if you're active and if you are actively able to do active exercises. These few exercises can make our day, and it would be good to make this a routine, like everyday routine, like brushing, taking bath. Okay, breathing exercises also should be a part of the routine. Okay, so the first exercise is deep breathing while on back. Okay, so we are, you can see the image. Okay, the position of the lady, she's lying supine and her legs are crooked. Okay, because when you are folding your legs, you're relieving tension in the abdomen. Okay, you're relieving tension in the abdomen. Okay, so comfortably crook lying position, lie on your back, bend your knees so that the bottom of your feet are resting on your bed. Okay, next, you should place the hands on top of stomach or wrap them around the stomach. We can wrap the hands around the stomach. Okay, here we are placing one hand on the abdomen and other hand on the chest. Okay, so where we can feel the expansion of both the abdomen and the chest. Okay, while we are placing it, it acts like reinforcement. Like, okay, we can check. Now I need to expand my chest. So this helps as a reinforcement. Okay, so for self checking. Okay, so we can place one hand over the abdomen, other hand over the chest to feel the chest expansions, to feel the breaths. Next, close your lips and place your tongue on the roof of the mouth. Okay, close your lips, place the tongue on the roof of the mouth. Breathe in through the nose, pull it down into your stomach where your hands are. Okay, try to spread your fingers apart with your breath. Okay, see, certainly when you can place hands, okay, or when you're checking for somebody for breath, if you place your hands when we are breathing, the fingers, when the chest expands or when the particular part abdomen expands, our fingers move apart. Okay, see, we can feel that, so you should feel that. Okay, next is slowly exhale your breath through the nose. Okay, slowly exhaling the breath through the nose, or in case we can also exhale through the mouth. Inhalation through the nose and exhalation through the mouth. Okay, so this is one type of exercise while you're lying on your back. Next, so in supine lying. Next, deep breathing while lying on your stomach. So prone lying. Usually when we are in prone lying position, we might feel difficult to breathe because our abdomen is not expanding, right? It is under pressure. So it's not very well expanding. So we might feel difficult to breathe in prone lying position. So even in prone lying position, what to do? Okay. So lie on your stomach, rest your head on your and your hands on your hands. Okay, to allow room to breathe. So if you're putting your face on the bed, the nose is also getting compressed, right? So place your hands and place your head on the hand so that you have room for your nose. Okay. Next, close your lips, place your tongue on the roof of your mouth, breathe in through the nose, pull air down into your stomach. Okay. And try to focus on your stomach, pushing into the mattress as you breathe. So while we are breathing, you should check that, you should enforce that the stomach is getting or compressing the mattress. Okay, not very forcefully, but you should feel the tension between the stomach and the mattress. Okay, next, slowly exhale your breath through the nose or through the mouth. Okay, and repeat deep breaths for 1 minute. Also, the rest time is also important. See, if you are doing 5 deep breaths, taking 5 deep breaths, deep inspiration and deep expiration, take a break, take 5 normal breaths, and then go for another 5 deep breaths. Okay, 5 deep breaths, 5 normal breaths, and 5 deep breaths. If you're continuously doing deep breaths without any breaks, we are hyperventilating ourselves. Okay, we are taking in more oxygen and throwing out less carbon dioxide. Okay, so we might end up hyperventilating. So while doing breathing exercises, we should be very, very careful to not hyperventilate ourselves. Okay, take in deep breaths, deep inspiration, follow breath hold, and followed by deep expiration. 5 of them, 5 normal breaths, and again 5 deep breaths. Keep a count of that. Okay. Next, prone position. We have seen in prone position. Next, deep breathing while sitting. Okay, as you can see, the hands are placed on the chest and on the abdomen. This is to feel the expansions. Okay, as I said, to act as a reinforcement to feel the expansion. So sit upright on the edge of a bed or in a sturdy chair. Okay, spine should be straight, neck should be straight. It should not be bent forward or extended. Okay, and spine should be straight. Place your hands around the sides of your stomach or one hand over the chest, one hand over the abdomen. Close your lips. Place your tongue on the roof of the mouth. Breathe in through your nose. See the same drill, pulling down the air into the stomach where we place our hands and experiencing the expansion of the hands. Okay, experiencing the expansion of the abdomen while you see the fingers moving apart. Okay, as we take in the air. Next, slowly exhale the breath through the nose or through the mouth and repeat the deep breaths for 1 minute. Okay, and as I said, even in the 1 minute duration, you should take 5 deep breaths and 5 normal breaths. Don't continuously take deep breaths for 1 minute. Okay. Next. So while sitting, so we have seen in supine lying, prone lying, while sitting, and next deep breathing while standing. Okay, stand upright, place hands around the sides of the stomach or one hand over the abdomen, one hand over the chest, closing the lips, placing the tongue over roof of the mouth, breathing through the nose, feel the expansion of our chest, of our abdomen, and slowly exhaling the breath through the nose or the mouth and repeating this for 1 minute. Okay, so we're doing deep breaths in supine position. Okay, just like once we are done sitting, okay, I've done today's deep, breathing exercises, and don't just leave. You have to do in all these positions. First, lie in supine, breathe for 1 minute. Next, take a break, lie in prone, do these exercises, sit, do these exercises, and stand and do these exercises. Okay, so breathing exercises are very important, and also like these are generally done. Okay, And there are, unless and until we see the patient and we are with the patient, we don't teach them. There are differentiations in breathing, like thoraco-abdominal, abdominal-thoracic breathing. Okay, this breathing patterns even differs from male and females. Okay, so based on that, we give therapeutical breathing exercises are different. Okay, what I'm saying are, the normal which we should do to keep our lungs hale and healthy. Okay, next, so I mentioned breathing exercises along with thoracic mobility, right? So the next is yawn to smile. So while you're breathing in, okay, your chest, expanding out your chest and bringing it back. Okay, so where you're also moving the whole musculoskeletal system along with your lungs. Okay, so what does this exercise do? This incorporates motion with breathing. Okay, motion with breathing, which helps increase coordination, build strength in the arms and shoulders. It also opens up the muscles in your chest to give the diaphragm space to expand. Not just the diaphragm, the lungs also space to expand. Next, so how to do? Sit up on the right, upright on the edge of your bed or in a sturdy chair. Reach arms overhead. Create a big stretching yawn. Okay, bring your arms down. Finish by smiling for 3 seconds. Okay, repeat for 1 minute. Okay, you're yawning and then you're coming back to smile. Okay, so this is another exercise. You see, these might seem very simple, but they are very effective. Okay, they keep our lungs good. Okay, so these breathing exercises, when we incorporate them in our regular lifestyle, they give better results. Okay, and we have other exercises like reinforcements like spirometers, incentive spirometers. Next, where there are 3 balls, you should breathe in and the ball should rise, breathe out and the ball should rise. Okay, so or you can just take a paper. Okay, you can just take a paper, hold it and blow it. Blow it. Okay, even that is a breathing exercise. You don't know. Blowing is also a type of breathing exercises. So incorporating these simple breathing exercises, it helps maintain the lung functions, improve the thoracic mobility. Okay, so yes, so I'm stopping. Yeah, so and I've just I didn't go very much deeply into the subject because it again depends therapeutically on, and not everyone should do few exercises. So I've shown something which is feasible and which should be done by everybody. Yeah, because there might be cases with hypercapnia and they might not be doing certain deep breaths, and so yeah. So thank you, and we are open for questions.
Thank you, ma'am. First of all, thank you for the information that you have provided to us. And I would like to ask you a few questions before we will stop this session. So the first thing that I would like to ask you is, you have, as a part of your presentation, you have categorized the patients basing on their symptoms as mild, moderate, severe, critical. So all the and there are cases where patients, even after recovery, when they go back home, they still have a certain extent of shortness of breath or certain extent of breathing difficulties. So
Yes.
the same, do you, according to you, the same set of exercises is applicable for all categories of patients, or patients who are critically ill need to have better physiotherapy than when compared to the normal people who are affected with COVID?
Yes, so it again depends on the extent of, on the type of, how, in which classification the patient comes under. Okay, so asymptomatic cases, they can regularly go for a jog, do any type of exercise. And where you're, when you are walking or doing any type of exercise, we are obviously working on our breathing, right? So when you're severely ill, you are in CPAP or BiPAP, you are definitely provided with oxygen. Okay, and critically ill, mechanical respiration. So when they have recovered, there are exercises, based on their functional ability, based on their, the boundary which they can do. Okay, so the set of exercises differs and depends on their illness. But like when you, what you've asked is like if a critically or severely ill patient, when he or she recovers and comes home, okay, they need to be doing more. Okay, and we also take care that they are not undergoing fatigue, because in severely ill cases, fatigue is like inevitable, right? And so the set of exercises is certainly and definitely different. And also, if I might be severely ill and I might come home recovered, and other person, and it also differs from me and the other person also. It's not the same. So that is why we should clinically assess, evaluate, and then prescribe the exercises. Okay, there's this thing called exercise prescriptions. We have heard of medical prescriptions, right? In cardiorespiratory physiotherapy, we work on exercise prescription. So exercises are prescribed, So not everybody, I might be suffering from fever and Dola might not work for me as it works for other person, right? It's just the same. Even the exercises are also assessed. The patients are assessed, evaluated, and then prescribed with these exercises. Yeah.
Okay. And I've heard it myself that there are certain misconceptions that are being present at this moment, where if somebody is advised to go for a physiotherapy once they recover from COVID, the general kind of misconception that we hear from majority of the people is that now itself I'm having difficulty in breathing. How can I go for respiratory exercises? Like, I would like you to comment on that.
See, you need to go because you are having breathing problem. You are going there for treatment. It is a therapy. It's not going to worsen, right? So this is definitely a misconception, because I'm saying this thing out of today's context, because yesterday itself one I wouldn't take the name. Somebody called me and they said they had pain in the leg. Suddenly they woke up from sleep, and maybe it's the position or don't know, they are experiencing pain in the hip. So I suggested them to go for physiotherapy or come to clinic. The first question that person asked is like, see, now I'm having only mild pain. So if what physiotherapists do is they put some current and all. What if it worsens? See, you're going there to get relief of that. So you're working on that. So if you are feeling breathless, or if you're not feeling good, you have breathing difficulty, that means there is a problem with your breathing pattern. Okay, your muscles might be compromised, your muscles might be weak, where your chest isn't expanding more. Your lungs are good, but your chest isn't expanding more. You don't know that. You need to get assessed. So we assess the problem. If there's a problem with the muscles, respiratory muscles, we work on expansion of that. Okay, we work on your wrong breathing pattern. Okay, and we definitely it is for betterment. Like no kind of therapy or treatment worsens. Unless and until it is done based on scientific this thing. So definitely there is problem with that person's breathing pattern. Okay, with the muscles, the respiratory muscles, or even the lungs. Okay, so we will work on that. We will see the problem, rectify it, and then improve the functional ability or function of the lungs. Yeah. So I highly advise to meet a therapist. See a therapist. Yeah.
And the last question that I would like to ask you is when it comes to respiratory physiotherapy, when it comes to the physiotherapy that target various respiratory cycles, like this could be a very basic question, but for the sake of audience, I'm asking this question. So is it just that these exercises activate the respiratory muscles, or they have something to do with the lung capacity also, where they try to expand the alveoli, and certain respiratory infections do damage a certain extent of lungs. So what exactly does physiotherapy target?
We target, see, like, so we are talking about lungs, like pulmonary function. Pulmonary function, when you are talking about the lung, we are talking right from the trachea. Okay, trachea till the alveoli. Okay, including the musculoskeletal system. Okay, so we work on the trachea, the bronchi, okay, the lobes, the lungs, the different lobes, the segments of these lungs. Okay, so just like when you asked, right? So if there could be a problem with the lower segment of the lower lobe of the left lung, okay, so there is a particular uh, position, particular set of exercises to to alleviate, to reduce that
Reduce.
problem, to get rid of that problem. See, unless and until it is like, severe damage to the alveoli and bronchiectasis and all, if the damage is irreversible, okay, so irreversible damages can be definitely done. And also, if, of course, if one lobe, my apical lobe is completely compromised, completely consolidated and irreversible. So what we physiotherapists do is we improve the function of the other lungs, like, to when this
Compensate.
is compromised, yeah, to compensate the uh, uh, loss of one lobe of the lungs. Okay, so we work on individual segments, individual lobes, and if one set is compromised, we are going to work on the others, improve the overall function to compensate the loss. Yeah. And also, while we are taking in oxygen, breathing well, we know enough oxygen we are taking. And this oxygen is being taken to the whole body, including our brain,
Brain.
right? So, breathing, when you are breathing, you're not just talking about lungs or chest. We are talking about even including brain to our nails, toenails, toes. Okay, so it helps in the overall well-being. Breathing helps in the overall well-being, right? So when you're working on the lungs, when your lungs are good, when your lung function is good, mostly all, even including your brain, all are getting enough oxygenated, and they're also performing good. Yeah.
Okay, ma'am. So thank you so much. Thank
Yes.
you for having a session with our institute, and
My pleasure.
we are very glad to have you here. And
Yeah.
we wholeheartedly thank all our participants and the speakers for all the 3 days for being with us as we celebrate the National Pharmacy Week celebrations. I hope we all had a good time, and I thank you. And with on behalf of Chebrol Hanma Institute of Pharmaceutical Sciences, I thank you all for your participation. And I hope that we'll all soon meet again for on